A random size controlled trial of cavity shaped margins in breast cancer. Introduction. Approximately 20 to 40% of patients have positive margins positive for tumor after partial mastectomy and require a second operation for margin clearance. Retrospective studies have shown that taking additional tissue circumferently around the cavity left by partial mastectomy, also known as mastectomy.
Cancer is the result of mutation of the genes responsible for the growth and health of the cells in the body. This abnormal proliferation may occur to the breast cells, which is called breast cancer. Breast cancer cells may continue dividing without a halt, resulting in a tumor. Breast cancer is common to women, but men are also susceptible to breast cancer. People suffering from breast cancer may not show symptoms at all, especially in its early stages. But a new lump or mass in the breast can be indicative of breast cancer. Generally, any change to the breast appearance, texture, and pain can be a sign of breast cancer. Nipple discharge or redness, breast or nipple pain, dimpling, or swelling of the breast can also be signs of breast cancer. Breast cancer has better prognosis once treated in its early stages. Thus, women are advised to undergo routine screening procedures to detect breast cancer earlier. Monthly breast self-examination, clinical breast examination, and mammography are the recommended routine screening procedures to detect breast cancer, even without obvious symptoms. Breast cancer development can be associated with a family history of breast cancer, early onset of menstruation, late menopause, dense breast tissue, exposure to carcinogens, the use of oral contraceptives, or drinking excessive alcohol. Breast cancer has various types. Some types are ductal carcinoma, lobular carcinoma, mucinous carcinoma, mixed tumors, and inflammatory breast cancer. Treatment of breast cancer is dependent on the type of cancer and its stage. Basic treatment options available to breast cancer patients are surgery, which involves the removal of the cancerous tissues, radiation therapy, that aims to destroy cancer cells by the use of high-energy rays, and chemotherapy, which treats breast cancer with medications. Consult your general practitioner whenever you notice any changes in your breast. He or she can examine you and refer you to a specialist if necessary.
Studies. We conducted a random control trial involving 235 patients of 18 years or older who had breast cancer of stages from 0 to 3 that had been diagnosed by means of core needle biopsy and who were undergoing breast conserving surgery. Study oversight. This study was approved by the Yale University of Human Investigation Committee. The study was monitored by the Data and Safety Monitoring Committee of the Yale Cancer Center with internal audits conducted by the Yale Center of Clinical Investigation Office of Quality Assure and Training. Results. Between October 21, 2011 and November 25, 2013, a total of 235 patients were enrolled in the trial. The results. On a pathological testing, 54 patients, the 23% had invasive cancer, 45 patients, 19% had ductal carcinoma in situ, and 125 had both. A total of 11 patients had no further disease at the time of the surgery, including 2 had a pathological complete response after neoadjuvant chemotherapy and 2 had the focus of the disease exercised completely at the preoperative biopsy. In the conclusion, our finding that routine cavity shaving resulted in cancer found in 12% of patients who were previously deemed to have negative margin calls. And to question the accuracy of margin status in predicting residual disease, these patients had multifocal disease that was detected after cavity shaving.
Tamara, you recently wrote a book called Defeat Cancer Now. Can you just briefly talk about the story behind that book?
Yes, well, in 2009, it was April 2009, and I had found a lump on my breast, and because I was busy getting my master's degree and I was almost finished, I was going to finish in June of 2009, I said, okay, I knew what it was in the back of my mind, and I was like, okay, well, I can't deal with this now. I'm busy getting my degree. So I put it on the back burner in the area, and it was really painful, difficult to sleep, and then it was itching at the site of the lump on my breast. And so by the time I finally graduated, I just, because I didn't have any insurance and I didn't have any money, so I just sat in front of the computer and I cried and I said, God, you put this on me for a reason, and so you're going to have to help. And I just asked him,